afternoon, everyone, and welcome to the Tri-City Regional Chamber's Network Tri-Cities Luncheon. I'm Lori Mattson, the President and CEO of the Chamber, and it's really great to see such a great group here this afternoon. Today's not only an exciting day for the Chamber, but for the Tri-Cities as well, as we kick off our spring Good Health is Good Business Wellness Challenge. And again, I hope you all had the opportunity to check out our Wellness Expo in the other room. And we'll have an opportunity after the luncheon to continue to do so. There were 23 exhibitors next door. You're all networking today. This is wonderful. This really isn't the worst thing that could happen. So we hope the networking will end at least when our speakers get up here, hopefully. So just a few facts about health and wellness. It continues to be a very important issue for our country and our community. The United States is in the middle of a health crisis that is impacting our society, and it will drastically impact our future if left unchecked. According to the Robert Wood Johnson Foundation's State of Obesity report from last year, more than 1/3 of American adults are now obese. Today, 19 states have adult obesity rates that are higher than 30%. And here in Washington, obesity has more than doubled since 1990. Today, 27% of adults in our state are obese, and this leads to other chronic health issues: diabetes, hypertension, heart disease, and many types of cancer that could be prevented by healthy lifestyles, and this is drastically rising in Washington. A few years ago, these concerns were brought to light in the Tri-Cities, as our community has been very fortunate over the years to be recognized by numerous publications as one of the best places in America to live, raise children. We have great schools and a great quality of life. But in 2012, Gallup Healthway's Wellbeing Index ranked the Tri-Cities as one of the most obese metropolitan areas in the nation. We were 9th worst, so of all, yeah, let's not fist pump that, Gary. Okay, so interestingly enough, we were in the early stages at that point of developing this Good Health is Good Business program, and the ranking reinforced that we were on the right track in providing the business community with a wellness program. More and more studies show that healthier communities are happier communities. The Good Health is Good Business Challenge is intended to foster a culture of health and wellness so our friends, neighbors, and our economy can thrive in a healthy environment. Data from the Centers for Disease Control and Prevention show that businesses that invest in their employers' health have lower health care cost and insurance claim. And it's a fact, unhealthy employees are less productive than healthier employees. So all of this leads to added costs that drain our economy. So I'd like to recognize a few of our sponsors that have been instrumental in the success of Good Health is Good Business. And these businesses include Cadlick Regional Medical Center, Lourdes Health Network, Ben Franklin Transit, Tri-Cities Community Health, and in particularly, I'd like to recognize Carol Moser. She's sitting here at the head table. Carol kind of puts her head down, rolls her eyes. I just saw that, Carol. But actually, Carol was really instrumental in starting this program with us. She reached out to the Chamber, and we've been partnering since day one. We were just talking about the first lunch we had to talk about this. So, Carol, thank you. And also Complete Nutrition. So please join me in thanking these businesses that provide resources in making this challenge successful. So a few more quick facts. Recent surveys of small business owners nationwide show that 93% believe that the health of their employees is vital to their bottom line. However, only 22% of small business owners offer a health and wellness program for their employees. So Good Health is Good Business is an excellent opportunity for the Tri-Cities business community to invest in their employees and promote individual health. So I really encourage you all, rather than start one, just participate in this really easy-to-use program. So today's luncheon is co-sponsored by Leidig Construction and the Tri-Cities Cancer Center, and their sponsorship includes an opportunity for them to speak about the organization. So first, representing Leidig Construction is Bob Benny, the Director of Business Development. Bob?
Well, again, I'm Bob Benny. I'm Director of Business Development for Leidy Construction Company. Leidy Construction is a 59-year-old construction company. We're based out of Spokane. We have offices in Bellevue, and proud to have a new office located here in the Tri-Cities area as well. Incidentally, I'm also the knucklehead that forgot the banner at home, so when you pass by our table, you didn't know who we were or what we do. but anyway, so Leidy Construction, again, we've been your business partner for going on 60 years, and we've done a lot of work, and you just might not have known it. We build a lot of your schools that we're proud of in this community. Wapto High School, Chihuahua are two great examples of some projects that we've recently completed in the Tri-Cities and in the Basin area. We help attend to the industry within the Basin. We're just completing the Wine Science Center at Washington State for Washington State. So look for a grand opening for the Wine Science Center here coming in June that we're all very, very excited about. We cater to the laboratories in the research and development within the area with our work at PNNL and our work with Schweitzer Engineering Labs within the Basin. We cater to our government buildings with our work on the historic Franklin County Courthouse, our work at Coyote Ridge Detention Center, and our work at Franklin County Justice Center. Again, Leidig is very honored to be a part and sponsor of this great event, but more so we're excited to be a part of the Tri-Cities area within the Basin, and we're excited to be a part of the Chamber. Enjoy your lunch, and thank you for having us.
Thank you, Bob, and thanks, Leidig, for everything you do for our community. Next up, I'd like to introduce Michael Novakovich. He's the Director of Business Development for the Tri-Cities Cancer. He looks like he's ready to do something serious here, so Michael.
Well, good afternoon, Chamber members. The Tri-Cities Cancer Center is excited to partner once again with the Chamber for Good Health is Good Business. And we've got an event coming up on Saturday, May 9th to help you kick your wellness challenge into gear. If you turn your attention towards the screen, we've got a brief video for you.
My help. My little sister who is battling breast cancer.
For me. My mom.
Our community. A cure.
My future and hope.
What will you run for?
So it's our annual Run for Ribbons Cancer Awareness Run Walk. It's Saturday, May 9th. All the proceeds raised stay local. They help cancer patients and their families in need right here. There's a 1-mile run walk. There's a 5K, a 10K, and we have a Ribbon Fest Health Fair. The health fair is available to the community. It's absolutely free of charge, and you can come down and learn about prevention of breast cancer and lung cancer. We talk about tobacco cessation, ovarian cancer, and skin cancer. So when you think about the promotion, we have the 300 Days of Sunshine. You can come down, make a bracelet. It's got little beads that'll change colors, show you your UV exposure, so you know when it's maybe time to duck into the shade. But something that's really important too is colorectal health. Isn't this a wonderful topic while you're eating your lunch? Awesome. Yeah. So, yay, colorectal health. Go colorectal health. We are going to be talking about colorectal health. Matter of fact, backed by popular demand is our giant 20-foot long, 10-foot tall walk-through inflatable colon. So this is, yep, it's entertainment at its finest. Absolutely free of charge. We ask that you come down and join us for that. But it's when you sign up for Run for Ribbons, and matter of fact, there's registration forms on your table. For if you're here at the Chamber lunch today, if you want to sign up, we're taking $5 off your registration. Or if you go online, if you enter Chamber, there's a promotional code. We knock $5 off. But what you get is you get a blank Cancer Ribbon T-shirt. Looks like this, and it's a Run for Ribbons tradition to decorate this in a manner that represents someone you know. Maybe it's a family member, loved one, co-worker even, that's battling a cancer. So it's a show of support or possibly to remember someone. And then for our cancer survivors, do we have anybody in here that's kicked cancer to the curb? Yeah, can we get a round of applause? Yeah, right on. Nicely done. So we have special yellow cancer survivors shirts, and we encourage survivors to come out. We have a special survivors ceremony. We want to recognize you. And this year we have a survivors tent where you can come, kick back, relax, refresh, renew before you go out and spend some time on the river. So Saturday, May 9th, run for ribbons. I look forward to seeing you there. And thanks so much for your continued support. Tri-Cities Cancer Center wouldn't be here if it wasn't for you folks. Appreciate it. Enjoy the luncheon.
Thanks, Michael. Thanks, Michael. Sounds like a great fun. So thanks both Michael and Bob also, and Leidig and the Cancer Center for sponsoring our lunch. So before we get started, we're going to announce our April Outstanding Member of the Month. It's a tradition at our luncheons. And this year, this month, our Member of the Month is the Tri-Cities Cancer Center. They have been a long-standing supporter of the Chamber, and the month of April marks their 21-year anniversary as a member. And through those years, they've been involved with the Chamber in many ways, including sponsorships, our annual business expo, and of course being involved with our Good Health is Good Business program. The center is a joint venture of Lord's Health Network, Catholic Regional Medical Center, and Trios Health. It opened its doors in 1994 as a freestanding nonprofit cancer treatment facility. And since then, the Tri-Cities Cancer Center has become a community resource for cancer treatment, support, education, and information. It's also a place where hope is intertwined with compassion, and dedicated professionals work alongside devoted volunteers. So please help me welcome the Cancer Center CEO, Chuck DeGoyer, to the stage to accept their plaque. Again, thanks so much to the Cancer Center for your generous support of the community, and we're proud to recognize you as our April Outstanding Member of the Month. So now I'm going to turn the program over to our 2015 Board Chair of Directors, which is Ron Boninger, to lead us through the rest of today's program. Ron.
This is a great way to kick off the exciting topic for today, to kick off this year's Good Health is Good Business program. And I think everyone can agree that here in the Tri-Cities we have a different vibe and energy than a lot of places. And why is that? Maybe it's the weather. Maybe it's all that sunshine that we see out there. But we also have rivers to wakeboard and swim in, mountains to climb, and we have Sacagawea Trail. That's always tough for me to say. 23 miles of riverfront walking from Richland to Kennewick to Pasco. It's a great environment all around us that gives us that energy. But at the end of the day, it is the people in our community that give us that vibe. It's all of you, by taking advantage of the great nature that surrounds us. That is why we see so much energy wherever we go, because people are hiking, they're swimming, and they're walking on the riverfront. And if you're not out there doing those things, this is the time to start. That is what today is all about. Good Health is Good Business is a great way to tap into that energy and enthusiasm and really make a difference, not just for yourself, but for our economy, but for each and every one of us. We can all take steps on our own that can improve our own health and also the health of our entire community. This is truly a program where every personal goal, everything that you do, no matter how big or small we may think it is, truly matters. Every time one of those goals is achieved, it's something to be proud of on a path to healthier choices. And in the process, strengthens the community around us and translates into a stronger economy as well. I'm very excited about this year's Good Health is Good Business program and hope that your business has employees that are participating, and of course all of you can also participate individually. Now I'd like to add a little bit of a personal note, a couple of quick stories. When I started up my company over 15 years ago, me and my other two partners got together for lunch and said, to be successful, we're going to be working long hours, thinking about our business every minute of the day. That is what it takes to start a new business. But we also said what is most important is that we take care of ourselves physically, that we stay healthy so we have time for our families and for our business. And it worked. Our business was successful, and one of my partners has done 5 marathons since we had that lunch, and another one did a lot of marathons and ended up doing an Ironman event in Phoenix I came nowhere close to those things, but I guess they listened to me. I should have listened to myself. But it really does work. Good health makes good business. And the other thing I'd like to share with you is I do a great deal of traveling in Europe. And it's amazing how many people you see out there in Europe on bicycles, hiking, being active. It's really common out there. It's kind of amazing. So as part of today's program, it's kind of to make me feel like the next time I come back to the Tri-Cities for one of my trips, I feel like I'm in Europe. I think we can do that. So now I'd like to welcome Elizabeth Holt, the Regional Chamber's Membership and Marketing Director, to the stage to present membership plaques to our newest members, and we love new members.
Thanks, Ron. Yes, we do. I'm excited to be able to introduce some of our newest members who are able to join us here at the luncheon today. So if I call your name, please come forward and accept your membership plaque from Ron. First of all, we have David Hare with Semper Fi Defense and Security. We have Janelle Dompier with Associated Agency Group. We have Luke Anderson with Skamania Lodge. John Evans with Complete Nutrition. Renee Janke with Synergy Med Aesthetics. And we have Bob Nash with Gather for Him Christian College. Please join me in welcoming these new members to the Chamber. Next, we would like to recognize some of this Chamber's long-standing members. The members I will mention have been members of the Chamber for 20 years or longer. First of all, we have Cadleck Regional Medical Center, Agra Northwest, Goodwill Industries, Kennewick Irrigation District, Perfection Glass, Clifton Larson Allen, Benton Franklin Orthopedic Associates, United Finance Company, Town Square Media, ALP Financial Planning, Images, Total Energy Management, Life Care Center of Richland, Benton Franklin Workforce Development Council, Mobile Hill Insurance, Windermere Real Estate Tri-Cities, Husk Office Furniture and Supplies, Farrell Gas, Moon Security Services, Fast Signs, Comfort Inn in Kennewick, Final Touch Upholstery, The Personal Touch, D. Hiddle and Associates, Round Table Pizza, and Canyon Lakes Restorative Care Center. We appreciate your participation with the Chamber. Let's give these members a round of applause.
Our spring Good Health is Good Business 8-week challenge provides the spirit of teamwork, friendly competition, and prizes to keep participants involved. After careful thought and consideration and evaluation of our program in the last 3 years, we decided to do 2 challenges, one in the spring and one in the fall. Participants can choose to compete individually or as a team. We've streamlined the program to make it more user-friendly. This year we're using an online tracking site, mobile app, and awarding more prizes than ever. The Spring Challenge begins this Monday and goes for 8 weeks. If you've already registered, thank you. If not, you can sign yourself or your company up today at the Good Health is Good Business booth on your way out. And the expo will be open after the luncheon for those of you who got stuck in traffic and couldn't make it to get through the entire expo. Now I'd like to introduce our keynote speakers. We've invited our community's 3 major health networks here today to speak on the importance of corporate health and wellness, and also give us some insight on the wellness programs they offer within their organizations. Each speaker will present individually, and after they have presented, we will bring all 3 speakers back to the stage for some question and answers. Our first speaker was born and raised in Pennsylvania. Through the span of his life, he spent 20 years on the East Coast, 20 years in the Midwest, and 20 years on the West Coast. That's kind of amazing to pull that off, especially 20 years evenly like that. He has an MBA from Wichita State. He's been working in the healthcare industry for 41 years, and we're lucky that in 2005 he moved to the Tri-Cities. To kick today's program off, please help me welcome Russ Kiefer, Chief Human Resources Officer, Trios Health.
Thank you for the opportunity to be here today. I'm proud to represent my organization, Trios Health, and also to stand in for our CEO, Glenn Marshall, who unfortunately is out of town and unable to be here today. As Ron said, the Tri-Cities is a pretty fantastic place to be. 2005, I came here in August, and shortly thereafter, I brought my family to the Tri-Cities. But as I look out over this audience, I still pretty much feel like a newbie at just 10 years in the Tri-Cities. It's a great place to work. It's a great place to live. It's a great place to play. And it's absolutely a fantastic place to raise a family. The Tri-Cities is large enough to have some retail and other venues of a larger city, but I especially appreciate that it still has that somewhat of a small town feel, like Mayberry, USA. And it wouldn't surprise me on any given day to see Andy and Opie walking down any given street in the Tri-Cities. We are also able to have community and business programs like Good Health is Good Business, and have both the community support and our respective businesses support and participate in such programs. Shortly, you're going to hear about two really great programs from my colleagues, Barbara and Lane. But I want to talk first a little bit about Trios Health, my organization. We focus on health and wellness for our community and for our staff on more of an individual basis. We have built into our benefit programs for our staff and into our care and our services for our community a variety of health and wellness focuses and opportunities. We truly want, in all we do, to have an impact on the social, mental, emotional, and spiritual health of everyone. About 2 years ago, I had the honor to bring together a team at Trios Health, kind of a grassroots effort of staff, providers, leaders, and we sat down to look at the mission, vision, and values of Trios Health. And not necessarily with the eye of changing it, but making sure that our mission, vision, and values fit not just where we're at today, but where we will be going in the future. Out of that came a new set of mission, vision, and values for us that were approved by our board last September. Our mission statement says, we are a unified team of healthcare professionals delivering quality and compassionate care to improve the health and well-being of everyone we serve. And our vision statement is to create a healthy community by providing unsurpassed care for each person's mind, body, and spirit. I was really pleased that this team of individuals looked historically at what we've done in healthcare, which is more episodic care and episodic treatment, and looked to the future and said, the future is going to be about health, wellness, and fitness, and that's what we need to be about. Studies have shown that health and wellness improvements are directly responsible for 30 years of increased life expectancy. We're living 30 years longer because of health and wellness. So I want to just share a few facts with you. Singing exercises your heart, lungs, and releases endorphins, which make you feel good. Now, if you sing like me, you do it in the car with the music blaring and the windows up, but just remember what it does for you. Acts of kindness make us happier and healthier. Reading reduces stress by 68% more than just listening to music or taking a walk. Exercising makes you both more productive and happier for the rest of the day. Laughing can dramatically improve your health and be as good for you as a deep state of meditation. And this last one is not so much about health and wellness, but as a healthcare professional, I wanted to share this with you. Redheads require up to 20% more anesthesia to be knocked out. Neil Armstrong said when he first stepped on the moon, a really unforgettable experience for those of us who got to see that back in July of 1969 as part of the Apollo 11 mission. That's one small step for man, one giant leap for mankind. Interesting, when he came back to Earth, he told NASA, that's not what I said. What I said was, that's one small step for a man and one giant leap for mankind. But after listening to the broadcast that we all heard, he acknowledged that the A kind of got out of that, and we say today, that's one small step for man, one giant leap for mankind. I really believe, and Trios Health really believes, that health and wellness starts with each of us, and it starts with our businesses. Individually taking responsibility and accountability for that first step. To say it another way, it's one step for me, it's one giant leap for my lifespan. Now, on the screen, I want to share with you a formula for good health. H plus F plus A squared plus C equals good health. Remember that formula. H relates to healthy. Healthy in all we do, healthy in our activities, healthy in what we eat. Healthy is our mindset. F stands for fitness. And it's not just our physical fitness, it's our mental fitness, it's our emotional fitness, and it's our spiritual fitness. When we combine a mindset of healthy with the mindset of fitness, we're well on our way of completing this formula for good health. A squared stands for accountability powered. We must take individually and as our businesses accountability for making this happen. And of course, with that accountability comes the responsibility. So it's accountability powered. And then finally, we must have the C, which is commitment. There's going to be lots of distractions and hurdles and opportunities to go off track. But individually and in our businesses, we must stay focused. We must lean into what's before us. And we have to be committed to this journey. Not a destination, but a journey of good health. And if you'll remember this formula of healthy, fitness, accountability squared, and then the commitment to make it happen, you will have good health. And with that, I thank you for this opportunity on behalf of Trios Health. And good health is good business.
Thanks, Russ. Some great messages that you had to say. Very well said. Love the formula. I can also picture you out there singing in your car. It's a great image. Our next presenter is Lane Savage, President, Cadillac Regional Medical Center. Mr. Savage has been the president of the medical center since the position was established in December 2006. He was previously the interim chief operating officer of the Alaska Native Medical Center in Anchorage, Alaska. Prior to that, he was the chief operating officer of the Ballard campus of Swedish Medical Center in Seattle, Washington. Please welcome to the stage, Lane Savage.
It's appropriate that I follow Russ on the stage because I followed him to Tri-Cities. He arrived here 10 years ago. I arrived here 9 years ago. So I kind of thought that was ironic. I wanted to start with a little bit of just general information about what do we as employers want. Basically, we want as much coverage for our employees as possible, right? We want to make sure that they have as much coverage as we can possibly get for them. We want to pay as little as possible in terms of premiums to get that coverage. We want a healthy workforce, obviously, for all the reasons that have already been stated, because of lower lost work time, less, and obviously as low a utilization rate as possible for our employees, so that our loss rate, our utilization rate will be as low as possible, and our premiums will be as low as possible going forward. So what do our employees want? Our employees want also as much coverage as they can possibly get, right? And they also want as low a cost as possible, but they're only looking at it from an out-of-pocket expense. So they want as low as out-of-pocket expense as possible. I think increasingly employees are looking for more assistance, more support, and more education in terms of how they can stay healthy. What do insurers want? You know, that's the third piece of the puzzle here. They want as much. They want as many covered lives as possible, which of course translates into premiums for them. And of course, they want as much coverage as possible that they can charge for. And they also want as low a utilization rate as possible, because the only way insurance companies make money is if they charge more for their premiums than what they're paying out for utilization, right? So that's obviously their incentive. So, do you notice any patterns here? We all essentially want the same thing, and it's all dependent on having a healthy workforce. We are also hearing a great deal more, all of us, especially those of us in the industry, about the Accountable Care Act and Obamacare and population health. It's kind of the new buzzword. I think we're going to be seeing and hearing a great deal more about this over the next few years. But essentially, it's going to change the entire focus of healthcare. It's going to focus on prevention. It's going to focus on health promotion and health improvement. It's going to focus on community health measurement and improvement. And it's going to result in greater risk assumption on the part of the providers as we move from payment systems that are based on you do more, you get paid more, to getting paid a flat rate to take care of all the health of a population that you represent. At Cadillac, we really encourage employees to take charge of their own health. We have about 3,300 employees now. I think that's about right, growing at a scary rate. And we also believe that we have a responsibility to look to improving the health of the community in which we serve. Some of the things that we do as part of our employee benefit program, first of all, we have annual wellness steps that we employ. We do a health assessment, an online health assessment for every employee. We do a lab draw for every employee. We do tobacco and nicotine testing. The information is put together and developed into a wellness report for the employee that really indicates where they have opportunities for improvement. And then from there, each employee develops their own wellness goals for the year. We have shifted away from the emphasis on strictly BMI and really giving employees an opportunity to identify their own goals and actually developing their own program. And this is how it's kind of come out in our recent year. About 35% really want to focus on exercise, 30% on weight loss, 20% on work-life balance, 15% on stress reduction. I think we probably all benefit from all of those things. We have a number of in-house programs that we provide for our employees to help them develop their plan and maintain their plan during the course of the year. These are just a few. We've got nutrition, weight loss management counseling, we've got running assessments, we've got 5K walks and runs, we've got BMI screenings, et cetera, et cetera. We've got a number of programs that we make available for our employees to help them maintain their goals. We also have a number of both programs and challenges. Obviously, we're a sponsor of Good Health is Good Business, and we also have a number of participants in that program. Living Well is a 6-week workshop for people with chronic disease to help them self-manage their health. We have a cross-train 45 program that's really focused on endurance and helping people really become more competitive in their exercise programs. We have a 27-day of wellness, which is a prep program for the 5K walk run. We have hikes and taking the stair programs and stuffing smackdown. Don't get the wrong idea. This is really a weight control program. It starts 2 weeks before Thanksgiving, and it runs through 2 weeks after Christmas. And so it's really intended to be a behavior modification program, if you will, for that period of time, which we generally, I don't know about all of you, but I suffer enormously during this period, and it's really a helpful program to keep people on track. We have a number of annual exams and services that we provide and make available for our employees. We've developed an in-house quick care program, and some of the services that are provided, we have a nurse practitioner who's managing that program, and it really has helped provide just kind of immediate access to some of the kinds of illnesses and things that have historically caused people to lose time from work. We have a number of online services that we also make available to our employees as part of our toolbox. We also have, we'll see caregiver throughout this presentation, and caregiver is a term that we've used to relate to all of our employees. We believe all of our employees are caregivers regardless of where they work within the organization. So again, a number of employee assistance type programs that are offered to our staff. We also have a community focus, and the Benton Franklin Community Health Alliance is an important participant, and Carol Mosier was introduced earlier, and she's really our leader as the three hospitals actually work together to really help identify where are there the greatest needs and opportunities for improving the health of our community. We also have identified through this process a need to look at the cost of health care. How can we reduce the barriers to access to health? And I think collectively we've done a great deal along those lines. I think we've also started realizing that we need to coordinate care better within the community. It's fine if we have patients in our clinics. We can manage the care of their patients while they're there. When they leave the clinic or when they leave the hospital, we have far less awareness of what their needs are and where that plan of care breaks down. So we're going to be focusing a great deal more energy and effort into really coordinating the care throughout the whole healthcare delivery process as we move forward. And we also have to be careful that we don't outstrip the capacity of our providers. We need to constantly be looking to bringing new providers into the community. All of us are actively engaged in, all of us in terms of the industry are engaged in physician education in multiple arenas. We also, Cadillac has obviously just developed a family medicine residency program. So we have our first group of 6 physicians who will begin training in their family practice residency program with us in just a matter of a few weeks. And we have developed very strong relationships with both CBC and WSU in terms of making sure that we have sufficient ancillary staff to meet the needs not only of Cadillac but throughout the whole community and the whole region. We also think it's important to to coordinate that care within the community, as I was saying earlier. We have, I think all 3 hospitals have social workers that work in the emergency room of our hospitals to make sure that the care that is required for those patients who are discharged from the emergency room have the greatest possibility of staying, maintaining their health after they're discharged from the department. We've developed a guided patient services program, a GPS service, where we make sure that every patient, before they're discharged from the hospital, they have a physician's appointment in their physician's office, so that there aren't any gaps in care. We make sure that, again, that if they require skilled nursing, if they require home health services, if there any kind of care that's required subsequent to the hospitalization, that care is coordinated and connected so that the patient, again, doesn't fall through the cracks. And finally, we've developed a heart failure clinic, which for patients who with heart failure is a very difficult disease to manage, and frequently they require rehospitalization. And the heart failure clinic is really intended to be a real educational resource as well as a clinical resource for those patients to make sure that they have a real good knowledge of how to take care of their health. There are a number of other things that Cadillac is doing and will continue to explore doing even more as we move forward. But I think this is a very, very exciting time. We have, I think, for the first time, I think we have an enormous alignment throughout the industry in terms of really how do we manage the health, not only of our patients, but of our community. And the incentives are there, and the opportunity is there. And I truly believe by working together, as we've begun to do here, we can make enormous benefits and improvements in the health of our community. Thank you very much.
Thank you, Lane. It's quite a comprehensive program that Cadillac has, and I love the way he ended with this opportunity we have to really do things better and differently and focus on our health. Our next speaker graduated from Northern Illinois University and for the past 24 years has worked in varying capacities in the human resource world. Prior to Lourdes, she was the Human Resources Director of Walla Walla General Hospital for over 10 years. She has been employed with Lourdes as the Executive Director of Human Resources since 2011, and during her free time is an active member of Kiwanis and enjoys meeting new people and traveling. From Lourdes Health Network, please help me welcome the Executive Director of Human Resources, Barbara Blood.
Thank you for the opportunity that you've given me today to come and to to you about the journey that Lourdes has been on with our wellness program. And when the journey began, I wasn't part of Lourdes. I wasn't associated with Lourdes. My predecessor, Craig Pearsall, heard a presentation from Med Incentive and Matt Henderson, who lives in our community. Some of you may know Matt. And he wanted to implement this program at Lourdes. He thought it really sounded great. And our CEO, John Searle, when he talked with him, John goes, no, I don't want us to do that. I've never seen, I don't think they work. I think that sometimes they're just fluff. And so eventually he did agree. He said, go ahead and try it. And a couple weeks ago when I was putting this program together, John was in my office and I was asking him a little bit about the history and some things that had happened. And I don't remember what I had for a title on this slide, and he said, you should change that title to Management Fantasy is Realized. And then he told me, and with a lot of passion, he said, how often in the business world do you have all these elements come together where the employer saves money and is satisfied, the employee saves money and is satisfied, and it was really a quality program that really instilled in our associates a wellness mindset. And so I'm going to talk a little bit about what some of those components are, and it's changed over the years. And that was in 2008, and the journey began in 2009. And the objectives of the the Med Incentive Program. And when I read these objectives, again, I was looking at history here, and I thought they met every objective. Was to encourage healthy habits, early interventions, and provide health information to associates. And they did those things through educational activities for our associates. And that appropriate intervention, I was told this story by several people that we had an employee who was 35, 40. He looked healthy. His BMI was in a normal range. And the first year that we implemented this and we did the biometric screening, he got his numbers back and he was shocked. He had high blood pressure. His cholesterol was, so to speak, through the ceiling. He just couldn't believe that. He thought he was a really healthy person. And his comment was, I think this program probably helped me not to have a heart attack because I wasn't going to a physician. I felt great. I thought I was healthy. And so he immediately could do something and turn those numbers around. And he became a huge advocate for this program. Another objective was to change the direction of the high cost of claims, and we did experience that, and I'll talk about that in a minute. Lower premiums and future premiums, and what we did there is we when we presented it to our associates, we actually presented a second health plan, and the second health plan had lower premiums, and so that was the incentive to get employees involved in this plan, and the percentage was pretty high. I'll show you that in a minute. And the last thing was the associate, and I put patient there because it's a patient-physician collaboration. And what Med Incentive does is it incentivizes both the patient, who is our associate, and the physician to be very active and really communicate with each other. And what they do is after associate sees a physician for whatever reason, say it's for weight management, they would get some information from Med Incentive through our third-party administrator that we use and given health literacy information on that topic. And then they were able to answer some questions, send it back to Med Incentive, and then they got a $15 check. And so there was a little money incentive there. And I had a couple of associates have told me that when they would get those, they would give them to their kids to fill out. And they felt that it was a way that they could learn some healthy habits and about some diseases or whatever. And then when the $15 came back, they got to keep that money, and it was a way to really put a wellness mindset to their children. So the initial wellness program that we went on, these are the components. We did a biometric screening, and that was really where associates would come in. Anybody that was on the plan went through the biometric screening, and that's where we found our numbers. They were weighed, blood pressure taken, blood drawn, and then they got the results back in a couple of weeks that showed what their cholesterol levels were and what their blood sugars levels were. And then the health risk assessment was an online site that our associates would go into. They would sign in. They would take those biometric screening results, put them in, and answer some questions to get their health assessment risk. And it'd be questions like, do they smoke? How often do you walk? That type of thing. There was health coaching with that site. After the associate went on and filled that information out, they would be contacted by a coach, either by phone or by email. And the coach was as a resource. And probably not every associate used their coach, but they did have that opportunity if they were struggling with something, that they had someone that they could turn to that would help them. We had a wellness committee that we established, and that was really to keep the information out to our associates throughout the year. Disease management was part of the physician and patient interaction that they promoted. And also the health coach would help with that too. And then the last piece I've already talked about on that side. So the keys to engagement, what we found was there was an incentive to participate. As I mentioned, we lowered our premiums on the wellness plan. Participating in education throughout the year, the plan was devised that every quarter, an associate to remain on this plan, they had to do 2 online educational activities, or we also had live activities, education activities at the hospital for them to participate in. And really, throughout the year, keeping that them engaged in the process, and they did sign a wellness agreement, and we tracked that they were doing those activities. And for instance, if one quarter they forgot or they didn't get around to doing their activities, we would get a report at the end from our TPA or from Med Incentive, and then we would take them from the wellness program and put them into the traditional program, and their health premiums went up. And so they were motivated then to, and they could make it up, the time they could go back and they would do actually 4 educational sessions, 2 for the quarter they missed and then 2 for the quarter they were in, and then we would put them back on. And so it did take some administrative time in human resources to do that, but we do feel that it was worth it. So the results of participation that first year was 78% immediately went on to the wellness plan. And I actually had never known this information until I was preparing for this talk, and I thought, wow, that's pretty good the first year, I think, to get 78% of the associates over into the wellness program. And then that went up 85%, 92%, 95% the first 4 years. And now in 2014, we actually left Med Incentive and we went over to the Ascension Health Smart Health Plan, and I'll talk about that in a minute. And they only have one plan, and it does include a wellness piece, and so all of our associates now can participate in a wellness plan. And this is a slide that I got from Med Incentive, and the 2 things that I want to point out here are they said that our return on investment was 12-1, and that over the course of the first 3 years, we saved over $3 million being on this plan. And when I talked with Matt Henderson about this, he said, Barbara, I think we probably actually saved more than that, because this slide was based on the national projection of health claims cost. And he said, when we went into this, Lord's claims were higher than the national average. So, you know, we were thrilled with the results. And then, as I mentioned, in 2014, January 2014, we were required to go to Ascension Health Smart Health Plan. And so I wanted to talk a little bit about some of the components last year, and then it's changed a little bit this year. And Dr. Michael Kobernick, who's the medical officer for Smart Health, is just a wonderful person and very passionate about the fact that wellness needs to be part of the plan, because that's the only way you can really affect change. And sometimes associates don't even know, what their numbers are, and if they don't know that, how can they change? And he actually came out to Pasco and talked with us about the plan that we had and what we were doing. He's talked with Med Incentive, and I don't know in the future if Smart Health will join with Med Incentive or they may do their own thing. Smart Health actually currently right now covers over 72,000 associates' lives. That's not their family members. And so they're very large, and the things that they've incorporated last year, it was a little bit simpler than what we had. The associates would go online through the Smart Health portal, sign in, and do a health risk questionnaire. And that again is giving them information on what are your habits, what things are you doing, and then they would give you a risk. Is your risk high, medium, or low? If an associate had a wellness or an annual physical with their physician, they were incentivized on that, and a biometric screen. And if they did that so that they got their numbers, they were incentivized. And how Smart Health incentivizes our associates is if you do one of those things, they will set up a health reimbursement card, which they put the money on a Visa and they send it to the associate's home, and that money rolls over. And so every time you do the activities, the things that you need to, they will put the money on this Visa card, and then you can use it for things that are covered by the plan that maybe is cost to the associate, like a deductible or an out-of-pocket copay. And then this year, the components, I just wanted to show you that it's changed a little bit. Again, we do the health risk questionnaire, and that's online. If an associate designates a primary care physician, they're given money for that. If they have that primary care visit to their primary care physician, then they're given money on their card. And this year they do have educational activities for our associates to do, and they're calling it Route to Wellness activities, and that is really pretty much like what Med Incentive had, where they have to do 2 educational activities each month. And I got this information in a dashboard a couple weeks ago, and I thought I would share this. Smart Health has a program that their wellness piece of it just started last year. And they feel that the foundation to their program, at least where it is right now, is their health risk questionnaire. And that's when an associate does it, they actually get the most money on their HRA. By filling out that questionnaire, they'll put $100 on that Visa card for them. And their goal this year of those 72,000 plus lives that they cover was to have at least 50% of the Smart Health members complete the health risk questionnaire, and the due date on that is June 30th. And so they were showing in a dashboard some information, and they showed that at the end of January, 42% of those 72,000 plus lives have already completed the health risk questionnaire, and they had it by the different hospitals, and we were the second highest at 68%. There was another hospital that had 70%, and I thought, I bet they had a wellness program. And when I saw that information, I smiled, and I thought, that we really have hardwired that into our associates' minds, that they know that if they're part of the plan, there's these activities that they need to do, and we benefit from it, and they benefit from it. And it has worked very well. So in closing, I just want to go back to what John Searle said that day in my office, that it really was the right things coming together, the things that you want. You want to save money, the associate wants to save money, and really a quality program that really did influence our associates to think that, this is something that I have to do. The wellness program is really important, and really high employee satisfaction. I've never had anyone complain about it. I've never got any pushback on our program. And our future, I know, it's changed over the last few years, and I don't know what it'll look like next year, but I do know that we are really committed to always having a wellness program attached to our health plan. So thank you for the opportunity to allow me to tell our story.
Great messages that we heard today, and one thing that Russ said, which stuck with me, is he said it's not a destination that health is all about and wellness. It's a journey, and I would add it's a lot of times a journey of very small steps, and sometimes when we try to start it, we go to the gym for like 2 hours straight, and we never want to do that again because we kill ourselves. Or we give up every single food and all we eat is vegetables right away. And I think that if we can do these just little things on this journey for the rest of our lives, we can really make a difference for ourselves and address the things that Lane just talked about, how things are changing, and take that responsibility. So it's a great program the Chamber's put together, and I hope we can all start that journey of many steps today.
Hi everyone. Today we have 3 door prizes, and we've pre-drawn our winners. So first, from Paragon Corporate Housing, a weekend stay at one of their fully furnished apartments. That's going to Angie with Sparkle and Shine. Next, we have a $25 gift card from the Country Gentleman, and that's going to Aaron Manili. And last, a beautiful spring bouquet from Just Roses, Flowers, and More. That's going to Brad Toner. And thank you so much to the businesses who donate door prizes each month. If you're interested in donating, see me after the program.
Thanks, Lisa, and thank you again to Lighted Construction and Tri-Cities Cancer Center for co-sponsoring today's luncheon. Cadillac Regional Medical Center and Lourdes Health Network for your gold partnership. Ben Franklin Transit and Tri-Cities Community Health for your bronze partnership. And all of our Good Health is Good Business wellness partners. Cadillac Regional Medical Center, Lourdes Health Network, and Trios Health for speaking today and offering us great advice on corporate and individual health and wellness. The Red Lion Hotel for hosting our luncheon. And lastly, Charter Communications for filming and rebroadcasting this program across our region. And it's been a couple weeks, but we'd like to take a moment to express our condolences for the loss of Lloyd Swain. We will definitely miss Lloyd sitting back there behind the camera with Nick at all of our events. He was a great friend to the Chamber and the Tri-Cities community and will forever be remembered. We're so happy to work with Charter Communications. Thank you, Nick, for being here today and carrying on for Lloyd. Also, join us tomorrow for our next Business Development University at the Tri-Cities Business and Visitor Convention Center from 1 to 3 p.m. Tomorrow's topic is the thriving workplace, boosting employee performance. To learn more, please grab a flyer at the registration desk as you leave. Also, applications are still being accepted for a great program, the Tri-Cities Economic Gardening Pilot Program. Do you want your business to grow? If so, this is the program for you. Economic gardening is designed to propel growth companies to their next phase of success. Selected businesses work with a team of national experts that utilize the most sophisticated research and business intelligence tools. The National Strategic Resource Team compiles valuable strategic information that is customized for that business, for your business. CEOs can then apply this information at their own pace to grow their business and our local economy. Some key areas the research team can typically assist with are strategic market research, geographic information services, search engine optimization, and social media marketing. The entire process only takes a few weeks and is so flexible, CEOs never have to leave their office. Economic gardening is a proven model that has generated positive results across the country. Thanks to the support of Battelle and Gisa Credit Union, 5 Tri-Cities companies will be selected to receive economic gardening assistance free of charge. This is the first program of its kind. We worked very hard to get this program in the entire Pacific Northwest. Has not been done here before. To learn more about the economic gardening eligibility criteria for the pilot program or to start your application, contact us at the Chamber or visit us on the website. I know I can hear some of the CEOs out there and the leaders of business saying it's really hard to take the time to do something like this. It's all really hard not to take the time. I assure you, when you step back from your business and have a group like this trying to help you, you'll get great value. So I hope you'll take the time to apply to this great program that we're piloting for 5 businesses. The next Network Tri-Cities luncheon will be our 13th annual State of the Cities, Wednesday, May 27th, featuring all 4 mayors from our region. This year's event will be a great opportunity to hear about economic development in each city as their plans to implement the new Tri-Cities brand, bolder and brighter. Okay, so thank you all again. We appreciate your time this afternoon. And remember 2 things. Go visit the expo if you haven't had a chance to do it. And it's great business to do business with Tri-City Regional Chamber members. Have a great day.